Okay, man.
All right, third try. We're very good at doing videos, so this is definitely the first attempt.
Yeah. We're just going to leave that in too. So, Dr. Cardinal, if you guys are on my page, you probably know who I am. And this is Evan McDaniel. Go ahead and give yourself a little introduction here.
Strength coach and athlete in Beaverton, Oregon. Work with anyone from general population to athletics and performance and everywhere in between.
Yeah.
Met Mike years ago at Stanford for a track meet back when we thought that we were very important. We still think we're very important.
Back when we thought that we looked good in spandex.
You still look good in spandex. You wore some last Halloween, I think.
Oh, my dad's.
Yeah.
I wore a 1970s wool weightlifting singlet.
Oh, it was something.
Yeah, that was brutal. Anyways, enough of that. You guys don't. If you go back on my Instagram, this is the proper picture. But Evan and I just did a little discussion where we talked about kind of both our histories athletically and educationally. We got kind of into the deep, never-ending world of core training.
Yeah.
And so we wanted to kind of give you guys like the Reader's Digest version of that, because if you want to listen to that podcast, it was like an hour.
Like an hour, a little over an hour.
Yeah, a little over an hour. And it's really good because it's thought-provoking, but we just want to do something that'll help you guys, that's short and sweet, and kind of what is core training, basic exercises that'll help almost everyone, and then if you have anything beyond that, reach out to me or reach out to Evan, because if you're beyond the basic exercises that we're going to talk about, you need diagnostic assessments.
Yeah.
You know, this isn't meant to be like we're diagnosing
the end all be all only core training video # best workout ever.
Yeah, exactly. I'm not that arrogant. Maybe in a few years, but so what we left off on our discussion that I really liked was, if you are looking at core training, the first thing you need to consider is, what are your goals with core training?
Yeah.
And is there an injury present?
Yep.
If you're doing core training with no injuries, then the pursuit of your goals is the thing that's going to dictate your program.
Yep.
If you're doing core training as an injury rehab, the primary focus is going to be building up resiliency to what injured you.
Yep.
And then hopefully doing that same thing that injured you or beyond that in a safe manner.
Without getting injured again.
Without getting injured again. Big point. And then from that, scaling it to longevity.
Yep.
And so what I would like to kind of touch on is, you need to be familiar with the ranges of motion of your body.
Yep.
And the capacities of your body, but you need to be a resident of kind of Happy Town. You need to be, you know, if this circle is Happy Town and this circle is what you can do, going out there is okay, but if you're out there constantly, something bad's going to happen.
Yeah.
Right? And so with people that come in to see me, the most common thing I see is they have low back pain from gardening or whatever, and then they go into a workout and I threw my back out, something, just hit me.
Yeah.
And a lot of the times it's repetitive trauma from being hunched over and having poor motor control of the core that then leads to an injury, or they don't understand what the core is.
Yeah.
So they only ever train one plane of the core, and then they don't have resiliency in the other areas.
Yep.
And so when I get a patient that comes in, most of the time it's a flexion injury, it's a rotational injury.
Mm-hmm.
And then what I'm going to train is anti-flexion, anti-rotation in a short duration pattern, and then I'm going to scale it against load and against instability.
Yeah.
At which point, I typically turn them over to you, because we have a lot of the same clients,
Yeah.
or to whoever their coach is after a discussion saying, hey, this is what they're capable of. Now you kind of take the reins. Please keep in a small percentage of whatever it was that we did that got them better.
Yep.
But also create the stimulus for something that's going to last for the longevity of their lifting career or just their hobby exercise program.
Yeah.
And so that's kind of where you would take over.
Yes. And then that's where, it, like I said, it kind of opens back up. Now it's like, okay, you are better from whatever injured you, or you're not injured at all. So how do you just develop strength and longevity, so that you don't get injured either, again, by the thing that injured you or by something else that you may potentially be neglecting in your training. So that's where it goes kind of very broad to very narrow, back to very broad again. And so a lot of that is done for me from doing a lot of resistance of movement training, a lot of the core stiffening stuff that you're going to do at the beginning of the workout that prepares you to take the load or whatever it is you're doing. Most of my people are doing very static strength stuff anyway. I don't have literally any people doing any Cirque du Soleil type stuff, nor do I have any business trying to teach people how to do that. So in this context, we're trying to get people just generally stronger, more fit, more capable for, I guess, normal range of motion type movements. So doing a lot of the stability training before getting into that. And then at the end of the workout, you can apply it either to a lot of loaded carries, a lot of strongman type stuff, where you're trying to do heavy loads, either symmetrical or asymmetrical, for some type of distance or for some type of relatively short time between 20 seconds and a minute. And then this is where you can also get into some kind of movement training for it. So you can do flexion, extension, rotation, but you're not doing things that are jerky, you're not doing things for super high rep volumes where you're just going to wear out those capacities, but it's more targeted hypertrophy for whatever muscle group is kind of lagging with that and needs to be worked on. So again, that's kind of the very general template that you can apply for anyone for longevity, but what exercise is best for you, it's going to come down on, it depends on where you're at, it depends on what you're capable of, and it depends on, again, what your goal is and if you have an injury. So that's where, if you're outside of the quote-unquote norm, if you're in an injured state, you need to go get a diagnosis, see what happened with that, or if you're just very weak or very strong and don't really know how to start or progress, then it gets a little bit trickier.
Okay, so we're going to assume that if you're watching this, you're in that last category. You are either weak or looking to get stronger.
Yeah.
If you're in the category where you have a lot of pain, please come talk to one of us and we'll kind of do an individual assessment for you. But let's first off talk about the person who is weak with flexion, extension, rotation, and tolerance. And then I will talk about kind of what my favorite things to do with them are, and you can kind of talk about where you would take that or what your favorite things are completely separately. So I had a question on Instagram about if flexion and extension is safe to train. And we kind of were talking about this a second ago. So yes, flexion and extension is safe to train, but what is the return on investment that you're looking for? So if your neutral range of motion is from here to here, that's something that is never really going to cause an issue because neutral is dynamic. Our bodies are dynamic. We have natural range of motion that we should never have pain in this area. And so then if you have, let's say, another few degrees in each direction of flexion and extension, then that would be almost what you would consider like the athletic range of motion, where you're going to be pulling on a clean and jerk or a snatch where you're hyperextending slightly, or to the point where you're picking up an Atlas zone where you're going to be in more of a flexion position. And then beyond that, you would have what's called physiological end range of motion. And so that physiological end range of motion is where your joints will stop you from going any further. And if you go beyond that, it's when you get sprain, strain, injuries, torn ligaments, stuff like that. And so the majority of our time should be spent here, with a small percentage of time spent here, and then a very, very small percentage of time spent at close to physiological end range of motion.
Those super end range of motion are always unloaded though. You're not.
It'd be like yoga, for example, something like that, or assisted partner stretching where you're communicating how you feel during it. You're working mostly on breathing exercises and allowing the body to relax into that position. That would not be something that you're trying to express movement arm. You're not trying to create strength or anything through that range of motion. And so when I have people that come in, most likely they've reached this and they've been injured. So my primary goal is to get their neutral to be pain-free. So how I do that is I start with their back assisted on the ground. So they're going to have stability on the ground by having their back flat. My favorite exercises for this would be dead bug with a foam roller or a ball between their legs. So now I'm crunching this together, which flattens out my lumbar spine, contracts my complete abdominal wall, and then I'm going to create a cross pattern motion. I will progress into that. If you can't do that without keeping your back flat on the ground, we're not there yet. Second thing I'm going to do, similar thing, is the McGill curl up. That's even more feedback for the low back because their hands under their back, they can feel if there's tension or not. Once those two things are to the point where under load, without load, under tempo, they can handle it, now I'm going to progress into more athletic things, such as a side plank, such as a rotational plank, pal-off press, something like that.
Yeah.
In all of my patients, the goal essentially is make you resistant and resilient to a fast impulse motion. So like if you trip and fall, you're going to be in a few seconds reacting. It's not going to last more than a minute, you know what I mean?
Yeah.
And so I want them to be able to handle any kind of load for at least 10 to 15 seconds.
Yeah.
Maximal contraction will get you through most events in life for 10 to 15 seconds. And so that's my goal. And how that is simple exercises: front plank, side plank, pal-off press, suitcase carry, dead bugs, and then you just add weight to that. I'm doing four to five rounds of 10 to 20 seconds of maximal contraction with perfect form. And then once they can do all of those and satisfy those, I turn them over to you. And then where do you go with that?
It depends on what their direction that they want to progress is. But I usually, for most people, I'm going to do a mix of getting more static endurance and then getting more dynamic power.
Okay.
So you're going to build up and be able to progress doing tougher versions of planks for a long period of time just to build up your capacity to maintain those positions once you have been able to demonstrate what a good position is. Not going past a minute for it, but definitely learning how to maintain those positions for a relatively longer period of time. And then we're also working on a lot of actual strength, movement, power type exercises. Again, those are a little bit more done. The static stuff at the beginning of the workout, the more dynamic stuff is going to come at the end of the workout. But again, it's always going to depend on what is your goal, how strong are you, and where do you want to take it. I'm not taking 90-year-old ladies who've never lifted before and having them do rotational med ball throws their first day.
But you do have an 80-year-old. He does have an 80-year-old world record holder in powerlifting.
I do.
And so, again, what your goal is, people wouldn't assume that that's possible.
Yeah.
And here it is.
Yeah.
So, with Evan, I know you've done a lot of stability training. I know you've done McGill's courses.
Yep.
And so, McGill is really big on front plank, side plank, bird dog, stir the pot, anti-shear, anti-motion exercises.
Yeah.
And so, for the purpose of them, let's use you as an example. You did a year, essentially, of extreme stability work.
Yeah.
To the point,
Only stability.
to the point that, like, I tried to do some stuff with you, and I couldn't do it.
Yeah.
And I never give a patient an exercise I can't do.
Yeah.
So that you were to the point of like, holy crap, extreme stability.
Yep.
What happened?
I injured myself doing a deadlift because I went a little bit out of my neutral position. I was being a little bit potentially lazy with the rep, but bottom line, I lost control of it, went a little outside of my norm, and I was injured. So since then, I've learned that you need to be, like you said, you need to be familiar with some different ranges of motion and outside of that ideal neutral position, because that's where you're going to get injured in a position that your body is not strong in. So if you don't expose your body to different positions, it's not going to know how to be strong there. And then it's definitely learning how to manage, well, how much stability work do I do? How much movement work do I do? And again, that's going to come down to case by case. Like you said, I had built up a lot of my stability over a long period of time. So now that's something that I was able to be like, okay, just put that on maintenance mode and focus on getting back into doing some actual movement, which started a lot slower than I wanted it to. Not doing a crunch for a year and then doing a set of 10 crunches on the ball, nice and controlled, was ridiculously hard. I was shaking all over the place. I hadn't taken my body through any actual movement there in a long time. So having to start at a low level and kind of build that back up. But again, everything is going to depend on where are you at. And I'm a fan of what's the easiest thing that you can make difficult, and then just start there.
Yeah, 100%. And a thing to point out, if you overdo one of these ranges, it makes the range smaller, right? And so if you only train stability, you had this as a neutral range of motion, but you've lost a little bit of the percentages in flexion and extension. So your neutral is now smaller and your chance of injury is now greater. And so what you're bringing up is you have to train stability if you want a lot of power, but you also have to train motion if you want a lot of power. What that's going to do is it's going to expand the safe barrier a little more into that unfamiliar zone, because you now have control out here as well as in here. And if something does go unplanned, you can handle it. And so I think a lot of people, they want an answer as what is core training, and you say, okay, do dead bugs, do sit-ups, do all these things. But core training basically breaks down to this: your core is a belt around your body. The purpose of that belt is to decompress the spine and protect the spine. So it goes from your diaphragm to your pelvic floor and everything in between. If you can expand and keep tension through bending, through flexion, through extension, you're going to be safe. If you do not have the motor control, well, more safe. You know, there's always an event. But if you lose motor control because you don't understand how to express motor control through a certain range of motion, then you're almost always going to get injured. And so when it comes down to core training, there has to be high resistance. There has to be high rep, and then there needs to be moderate in between both. And how that breaks down is, if you only ever do high resistance stability, you're going to lose range of motion. If you lose range of motion and something does pull you out of range of motion, like a max deadlift or a high percentage deadlift, almost always will, or a squat, you're going to get injured. And so don't go gangbusters and be trying to do like, I'm going to do weighted toe touches and now my back's great for everything. No. Learn how to separate your core from your hips. Get your core really strong and able to handle flexion, extension, rotation, and then understand that most people train their core thinking they're training their hips, and train their hips thinking they're training their core. Get your hamstrings, get your glutes to fire properly, and then have that core transfer power from the legs to the shoulders. Make sense? And so,
it's as easy as that.
And then, you know, the magic program is whatever you're going to do, first of all, whatever gets you closer to your goal, and then find a way to challenge new variety. Make sense?
That's it.
And so we tried to get to that over the past hour and a half, and it kind of just dawned on me in this moment. People want to know what's the best way to get the core strong. Challenge it in safe environments, and then expand those safe environments into challenging environments that then become safe. Whether that's only planks at the beginning and then progressing to a heavy suitcase carry, that's awesome. If you can already do a suitcase carry, if that's adding in a pal-off press, you know, change it up, but make sure that you can control the motion and not go, if I had to hold it one more second, I was gonna die. Separate your shoulders and your hips from your core. So many people think that they're doing a deadlift and that was a deadlift. That was all my back. The functional unit of the lower body is the hips. People that hurt their back most often think that doing 1,000,000 sit-ups is going to help them when they're really training a flexion pattern. Sit-ups aren't bad if you understand how to separate a lumbar flexion pattern from a hip extension pattern. And that's kind of where my beef with flexion training is. A lot of people do a ton of sit-ups when really their hamstrings are so weak that they're thinking they're bringing their hips to neutral by getting the lower abs stronger, doing raises and sit-ups all day. That's great for looking cool, but if you can't control the anterior and posterior pelvic tilt with your glutes and your hamstrings, no amount of core is ever going to make you functional. And so that's the long and short of it from me. And you can kind of have your finishing statements.
I think that was it. The biggest thing to really touch on is just the function. Like, what do you want it to be able to do? What do you need it to be able to do? And then I think you said it very succinctly, it's exposing yourself from starting with a safe environment to more challenging environments, and then making those safe environments. That's what you want to do, is how big can I get that circle of safety? How strong am I within that? And where are my edges? And do I know where my edges are? Do I have control outside of those edges? And how far do I need to get that zone of safety to be doing what I want to do? Going for a heavy deadlift and trying to be amazing in yoga are going to be very
goals.
they're very different goals. So one, you're going to need more stiffness. One, you're going to need more mobility. So it's always going to come down to that context. But yeah, how do I create a bigger zone of safety, and how do I get brutally strong within that zone?
Okay, and the one thing, Evan's taken a couple of Go courses that I haven't taken. And so you talk about zones. And so this is the last thing I kind of want to touch on, because this makes more sense than our hour and a half discussion, to be finally we both got in the same brain wave here. If you're looking at zones of strength, adaptation, everything like that, you also have to look at zones of the body.
Yeah.
So most people that have core issues are really strong in the front, and that's their zone that they work the most, because that's the one they can see.
Yep.
And they might have decent strength in their back, which is another zone. So you have front, side, and back, right?
Yep.
And so this whole time we're talking about core, I think people think we're talking about a six-pack. We're not. When we talk about core, we're talking about what envelops your entire body. It's your abs, your transverse abdominis, internal external oblique, your deep spine stabilizers, your psoas, your quadratus lumborum, your lumbar extensors, your pelvic floor, and your diaphragm. So you need to train breathing exercises.
Yep.
You need to train lateral side planks, stuff like that. You need to train extension, and you need to train flexion, as well as you need to train resistance to lateral bend, resistance to flexion, and resistance to extension.
And rotation.
And rotation, especially rotation.
Yeah.
Most people get really bad at rotation, and you see that later in life where they can't turn.
Yeah.
And if you don't think that rotation is important, you've never picked up a little kid.
Yeah.
Right? And that's always what happens. They go, oh, I just grabbed my kid like this and my back went out. If they turned and grabbed their kid straight forward, the back probably wouldn't out.
Yeah.
And so that was an area that they never thought to train. The body's dynamic. Train all motions as long as it's not creating pain.
Yeah.
And if there is pain, talk to one of us. What we're going to advise you to do most likely would be get close to that pain as long as it doesn't hurt and come back out.
Yep.
Once you've done that enough times, you create resistance and resiliency here. That pain barrier will expand, and then we're going to train that new motion that we've gained.
Yep.
So I think we agree on that.
Oh, absolutely.
I think that was way better than our hour-long discussion.
This might turn into another hour-long discussion if we...
No. I'm going to cut it off because I want to post it on Instagram. And where can they find you?
EvanMcDanielFitness.com or at Evan McDaniel Fitness on Facebook and Instagram. Also a trainer in the Beaverton, Oregon area. So if you're out here, look me up. I'd love to help.
And then obviously Strong Life Chiro is my personal page, Strong Life Chiropractic. And then I have Strong Life Chiropractic YouTube, but it's been bad about posting on that.
Eventually we will. If
you go to my Facebook page, Strong Life Chiropractic, I shared his article that you wrote about core training.
Yeah.
I shared that yesterday. I'll share it again when I post this. And at the end of your article, you actually have like a 12-week core training program.
Yeah, it's just a very basic idea of, hey, here's all of the exercises and here's a way to progress them. Not meant to be the only program that you'll ever use, but more of an idea of, okay, well, how does it look like to go from a simpler exercise to a progressively more challenging exercise over a period of time.
And so if you guys have any questions and you can't get a hold of us, check out that article. That'll give you a pretty good overview of how to do it. It gives you examples of how to do it. And ultimately, if you don't have an injury, experimenting with progression is the best way to figure out what's best for your goals.
Yep.
once you've ran out of variations, ask someone else like myself or Evan, and then we can help you tailor a more varied and more suitable program to get you past whatever sticking point you've reached.
Yep.
So I think that was pretty good.
I think that's it.
And just fun fact, maple syrup is way better in your coffee than just black coffee.
That's a lie.
Go ahead. Ugh. This is why I have to talk about things. It helps my brain.